This was not originally supposed to be my session. I was probably given it at the last moment. I was supposed to take a session that is tomorrow under Noto. Can I have the next slide? Can I have the next slide, please? Should I change it from here? Okay. So we'll be discussing under understanding the current impact of non-communicable diseases on health costs and economy, raising awareness, what are the strategies and challenges, moving from awareness to concrete action, if there are any innovative approaches for NCD prevention and management, and how to measure success and after that sustaining progress. Now we are aware what are the non-communicable diseases. Let's first discuss the impact. What is the impact of these non-communicable diseases on health costs and economy? We understand what are the NCDs and what are the primary NCDs. The major ones are cardiovascular diseases, cancer, chronic respiratory disease, and diabetes. These together form the major chunk of NCDs, which actually lead to even organ failures and which create problems. And of course, we are also aware that there are a lot of factors behind the development of these NCDs: genetic, physiological, environmental, and behavioral. These NCDs actually contribute over 70% of deaths worldwide annually. In India, this figure is about 68.4% and impacts all regions and demographics. NCDs actually impose a significant challenge as far as quality of life is concerned and healthcare systems also. And we are all aware of these NCDs who are managing in various hospitals. Economic impact is especially excessive on the low and middle income countries, as India is one of them. This is the current Indian situation. About 28% of adults are hypertensive. Diabetes prevalence is about 9 to 10%, and as per WHO estimates, what they estimate, it may go up to 20%. Then liver disease, non-alcoholic fatty liver disease affects about 25 to 32% patients, with COPD affecting about 5% patients. And they cause quite a bit of loss. They also are a cause of out-of-pocket expenditure to the patients. Various values have been mentioned, and they do cost a lot to the economy. Now, how important is this data relevant to this conference? About 28 to 35% of Indian population suffers from some NCD. India has about 0.25 million new cases of chronic renal failure every year. Out of 13,476 renal transplants which were performed in 2024, nearly 11,558 were live. They were live transplants. And if I say that if we perform 0.25 million transplants every year, like it is proposed to, we should perform transplants for all patients of renal failure, we'll end up leaving about 0.22 million donors left with a single kidney. So with current prevalence of NCDs, will we find donors in future in terms of healthy individuals who don't have NCDs, or in terms of people who have already donated? So it's important that you think in terms of treating and preventing NCDs, preventing failures, rather than just talking of transplants. Now, when you talk of risk factors, we are aware of, say, non-modifiable or modifiable risk factors. We'll be discussing primarily the modifiable risk factors. Lifestyle risk factors like tobacco, unhealthy diets, physical inactivity, alcohol. Environmental influences, the change in environment that is happening at a fast pace, the what you call as global heating or whatever, it actually impacts health very significantly. We may not notice it, but I think people on the ground feel the impact with the temperatures touching 50 degrees. Social determinants like economic status and education also affect health outcomes. And let me tell you here, education does not mean degrees, something which is also perceived in medical education, that people who have degrees, who have higher degrees, turn out to be better doctors. That's not so. So education is really to understand the impact of lifestyle influences on health, which probably some of us also don't appreciate. So we need to raise awareness awareness about the NCDs, their impact on health, and there are challenges and there can be strategies that could be used. So we have to think fresh, but we have a lot of challenges in changing these perceptions. What are the barriers to changing perceptions? I've mentioned in capitals and red industry. I'll mention that in detail. Industry is one of the reasons why perceptions are not changed. Then misinformation. Misinformation that is available across the globe. What is healthy in terms of eating, what is not healthy, what is harmful, we are not even aware. Even today, when I sit in my OPD, educated people think that cornflakes are healthy. Hypertensives think cornflakes are healthy. They are not aware of the amount of salt in it or the effects of processed corn. Then I say cultural beliefs, stigma, and limited resources. Why I mention limited resources? Because when I'll be talking of changing in lifestyle or changing food habits, even in the developed countries, the unhealthy food is available dirt cheap. Most of the population is able to afford a burger, but they will not be able to afford healthy salads. A burger, if it costs $1, the healthy salad costs about $15 to $20. So resources becomes a challenge for a majority of the population who want to change lifestyles. Then the second thing I've mentioned, uneducated health care workforce. I wish to know and I wish to learn that how many of the doctors are aware of what is healthy. It's very easy to write in an OPD slip, healthy lifestyle. What that healthy lifestyle is, do we actually explain to the patient? Do we actually make the patient aware? And then there is a complete loss of trust because we started treating patient as a client. Patient is no more a patient, he's a client. Similarly, healthcare is no longer a service, it's a delivery. It's a delivery like in any business. So there is complete lack of trust, and that's why patients go out doctor shopping. They're not sure of the advice they're getting from anywhere. So I said industry. It's a story of 4 industries and 2 lobbies. Manufacturers of diagnostic implants and instruments equipment, that is the first industry. Pharmaceutical industry is the second industry. Third is the food processing industry. Fourth is the agricultural industry. You see, such massive are the changes in these industries. They look only towards profiteering. They don't care of the health of the patient. Nobody talks about the health of the patient. For example, today we are talking of microbiome. And I don't know if you are aware, there is already, a lotion available by the name of microbiome, which they say will restore the microbiome of the skin. So I'm sure this word microbiome will also be commercialized by food processing units, even agricultural industry. Similarly, tobacco and alcohol are 2 strong lobbies. Any number of laws are not able to take control of these lobbies. And people are still suffering from it. Consumption of alcohol and tobacco has not really decreased. Recently, I was in Kolkata and I found Durga Puja days. Lot of smoking, and among ladies. It's not gender specific, it's gender independent. So when you talk of, the approaches to it, when you talk of public health campaigns and education, the primary focus has to be on risk factors and healthy living. The secondary focus, which is the prime focus today, that is early disease detection for better outcomes, that's important, but that has to be after the primordial prevention. And key outreach venues, we never map them. It has to be schools, workplaces, and communities. We have to start young. But our school canteens also sell unhealthy food, packaged food. So there is what needs to be started from and aimed from. Well, has the role of media and technology been overhyped? My answer to that is yes. Yes, it can enhance outreach and engagement. But is that audience really the audience that you need to actually approach and inform? For example, today NCDs are increasing tremendously even in our rural areas. And whether we may be happy about it or sad about it, we don't send a doctor to the rural areas, but you will have Maggie, your Lays and colas in every corner of the country, in every village of the country. So we need to think about it. Are we giving the right information, relevant information? Interactive education is good. If it's properly utilized, it does improve accessibility, and it can improve quality of health education, but it is no substitute for teaching. Most of the teaching institutions are short of teaching staff today. So whether you can actually make doctors out of just interactive things available on the web or on the YouTube, I'm not sure. Social media campaigns. Social media again has a limited outreach. I think even today, Prime Minister's Man Ki Baat has a much more outreach than any of the social media campaign we may be having. And one thing that Honorable Prime Minister mentioned regarding 5% reduction of sugar and oil probably would have had much more impact than any of the other social media campaign. Similarly, mobile health applications. What I have written in red is what is mentioned on the net, that these applications empower individuals. I think they trouble individuals more. You are checking your BP 4 to 5 times a day. You are getting tense about it. Well, BP changes with every beat of the heart. It doesn't need to be monitored 4 to 5 times a day. You need to be careful using these mobile health applications, whether they would be useful. So, how do we move from awareness to concrete action? The mindset of the people need to change. Mindset of the people who are receiving treatment, mindset of the people who are trying to treat, both has to change. Focus from diagnostics and therapeutics has to shift to focus on primordial prevention. If we talk of prevention today, we talk of only vaccine. I'm sure a vaccine for obesity is in the pipeline too. But I think the focus of the physicians also has to come to prevention. Then from working for healthcare industry to working for the patient. This is the second mindset that needs to change. From treating patient as a client to treat patient as a human being. How many of us try to understand the patient's problems? From continuously increasing cost of healthcare to actually decrease the cost of healthcare delivery. If you look at the cost of healthcare, it's exponentially going up. And unless you have a health insurance, you are yourself not able to afford it. So you have to think in terms of decreasing the cost of healthcare, which will come only if you start thinking of prevention. Then mindsets needs to change from a line in the prescription, healthy lifestyle, to practice of change to that healthy lifestyle. It's very easy to line that line, healthy lifestyle to be followed. What is that healthy lifestyle? I'll be discussing some of the points. From voluminous prescriptions to economical prescriptions. If I analyze prescriptions today, at least 50% of the drugs are not required. Why they are written is for the person who writes it, he knows it, or the industry knows it. A change from corporate medical structure to institutional medical structure. If the corporate medical structure persists, I don't think we are caring about the health of the country or the patient. Then the stress on private health sector. Today, 70% of the healthcare in India is in the hand of private sector. Unless it comes back to the government health sector, I don't think health of the patients will be actually taken care of. And I'm very categorically when I state that. You see, COVID was one example where if the government institutions would not have been functional, probably patients would have suffered much more. So we come to policy interventions and government initiatives. As I had talked about lobbies, tobacco control laws have been there. They have not really contributed much. In the vicinities of schools, in the vicinity of teaching institutions, you still find tobacco sold. Although there is a law that within 1 kilometer of a teaching institution, there should not be a shop selling tobacco or tobacco products, but you don't find that happening. Similarly, people have been talking of sugar taxes implementation. Why not subsidize non-sugar alternatives rather than, we've taxed cigarettes heavily, but smoking has not decreased. So what's the point putting on taxes? You subsidize a lot of things. Why not subsidize non-sugary alternatives, healthy alternatives? And I think there is a time for nutrition label or warnings. We put warnings on cigarettes. I think FDA has now improved, US FDA has approved warnings on alcohol. I think similar warnings should be there on processed food. Similar warnings should be there on bakeries, that these things are actually harmful and can contribute to NCDs, can actually spoil your health. And we need investments in health promotion and disease prevention. Investments come only in diagnostics, therapeutics. It does not come in prevention. Unless those investments come. And those investments are also, sponsored. For example, you have certain foundations which sponsor research, but they don't talk of prevention. They actually talk of research which suit their own products. Community engagement and grassroots movements, yes, will promote healthy behaviors. They will also support vulnerable groups, and they will also advocate environmental change. But just advocating environmental change will never help. For example, I've been telling in a lot of things that I addressed as Director General Health Services. In any five-star hotel, when a convention is held or a conference is held, you have ACs running at 18 degrees, 19 degrees. And what are we doing to the environment? All of us are actually feeling cold. People are wearing suits when they're not required. But factually, you will not put the temperature at about 24, 25, which is the optimum temperature. So what are we doing to contribute to the environment? So need to actually put those things in grassroots rather than just advocating them. Healthcare system strengthening. We are focusing on tertiary healthcare systems. We need to focus on primary healthcare, which is extremely important. Unless that is strengthened, things will not work out. Health of the country or the patient will not work out. Similarly, healthcare workforce has to be trained in the right direction. Today we say an MBBS is useless. I think an MBBS is the most useful to the community if properly trained, if he's ready to function as a primary physician. But the problem is we tell them that you are useless as MBBS. You have to do an MD. You have to do a DM. Otherwise, you will not be useful. Access to essential medicines, of course, is now being ensured with the Honorable Prime Minister's cheap medicines through Jan Aushadhi. What could be the innovative approaches for these NCD prevention and management? We'll try to discuss. Could there be digital health solutions in telemedicine? I've already answered that question earlier. I don't think they have too much of a role. We have a lot of these mobile health applications coming in. We have a lot of these wearable health devices. Yes, telemedicine can be a good, innovation for areas which are hard to reach. But however, there will not ever be a substitute for non-availability of trained medical personnel. Coming to the real thing, that is lifestyle modification and preventive care. Beginning with diet, what we eat, how we eat. Healthy diet, when we talk of healthy diet, I want to discuss the Indian way. I don't want to practice a Western diet here. I don't want Indians to have olive oil just because the West says it's healthy. So balanced nutrition does help to reduce NCDs, but balanced nutrition needs to be defined for Indian population. Similarly, apart from being balanced in diet, the diet has to be simple. Diet doesn't have to be complicated. It doesn't have to have 6 or 7 courses. I think the most nutritious diet in India that has ever been eaten is khichdi. We are all aware of that. It's a very balanced diet, aware in every part of India, made in different forms in every state of the country. Avoidance of processed, ready-made, ready-to-eat. This is where I was talking of the food processing industry. We will have to fight this food processing industry, otherwise it will be very difficult. Second question is how frequently one should eat. There was a thought process that had come in from the West some years back. Small, frequent meals. Well, I may be harsh, but I believe it's a nonsensical concept. Every time you eat, you are going to raise your blood sugars. You are going to produce hyperinsulinemia. And hyperinsulinemia is the biggest contributor to NCDs. Whether you talk of diabetes, whether you talk of hypertension, whether you talk of hyperlipidemia, you talk of PCODs, hyperinsulinemia is the basic problem. So if I go back to the old Indian concept, being an agricultural country, we used to eat twice a day, maximum 3 times a day, and that should be enough. And last meal of the day in India used to be always before sunset, which actually would produce a 10 to 16 hours of the gap before the next meal, which has been brought in today as intermittent fasting. It's not a new concept. It was a concept that was already accepted, available in India. Then you have to seriously think in terms of restoration of the human microbiome. That's the way forward if you want to protect any disease, whether it's non-communicable or communicable. Unless that human microbiome is restored, it will not be possible. Coming further to lifestyle modification, there's lot been, it has been criticized. The divine hour or the Brahm Muhurat Is it just a religious fad, or is there something scientific about it? It's very scientific. Our circadian rhythm begins at that divine hour, begins at that Brahmurat. The hormone secretion of the body, the cortisol secretion, starts at that hour, 4 a.m. in the morning. And was there ever a concept of eagles and owls, people who used to stay awake during the night and work during the day? It was again a concept that was brought here just to change the lifestyles. Circadian rhythm is the safe for every individual. You may change it later on, it's not otherwise there. Then a lot has been discussed about sleep hygiene. What is the sleep hygiene? The person, who works hard in the field or as a laborer sleeps the best. He doesn't require a bedroom. He doesn't require a darkened area where there is no light. He sleeps anywhere. So you need to revisit the concept of sleep hygiene and how much sleep does that one need. Our honorable Prime Minister sleeps 4 hours a night, and the way he functions, you don't need 8 hours of sleep. You don't need 10 hours of sleep. You need a good 4 hours of sound sleep, and that has to be thought of. Why are we not getting it? So this is the circadian rhythm, a small example of the circadian rhythm. Your brain needs rest between 10 a.m. to 2 a.m., 10 p.m. to 2 a.m. in the morning. If you don't give it rest during that time, it's not going to function well. So every aspect of the human body has some bit of circadian rhythm, which if not taken care of, will actually make you prone to diseases. Further, in lifestyle modification, reduction and maintenance of weight. In my OPDs, about 40% of the individuals coming are obese, and they don't belong to a good socioeconomic status. They belong to low and middle socioeconomic status. So don't think that obesity is affecting people who are eating well. It's also affecting people from the lower socioeconomic status, and we really need to look into it. Why is it so? We talk of active lifestyle with physical exercise. That doesn't mean gymming. It means that lifestyle needs to be, the exercise has to be incorporated in terms of daily living, which means walk more, walk to the nearest market, climb up stairs, rather than taking out special hours for a morning walk or an exercise. De-addiction, as I have already mentioned, need to go beyond legislations and laws need to be strictly enforced. And yes, regular health screening is important, but the so-called executive health checkups have to be rationalized. They contain nonsensical investigations more than, bundled up free. That for with 10 investigations, you have 10 free, and they have, patient thinking and under stress that what are these abnormalities that I have. Partnerships and multi-sectoral collaboration does help. Government, private sector, NGOs, and communities working together, they can, jointly enhance resource mobilization. However, these can help us to combat NCDs. How do you sustain progress? The only method is to continuous, like you have a CME for doctors, you need to have a CME for the general public. They need to be continuously made aware that what is harmful for them and what is useful for them. And there have to be supportive environments that encourage healthy choices. As I mentioned, our schools and college canteens, even our hospitals, do they sell healthy alternatives? You have the same packaged processed food available. So if we can't really do that in our own environments, what are we talking of? And community initiatives and policy measures to actually support healthy habits for long-term success is important. If there are successful practices, they can be tailored to local needs, not verbatim. They cannot be applied anywhere. These have to be culturally acceptable. So you could use the cultural leaders, the religious leaders, to actually enforce the healthy habits. And global and national cooperation will work only if the intention is not to balance industry and health. There is no balance which can balance industry and health. It will always balance towards industry. So health has to be thought of differently and specifically if you really want to take care of NCDs. Otherwise, it will be very tough. So conclusion, yes, we need to have a comprehensive approach. Effective NCD management needs a holistic strategy with health education beginning in schools, preventive strategies to sustained policy interventions, collaboration, partnership across systems of branches of medicine. Modern medicine cannot sit alone. You have to have, we have good five systems of medicine which need to collaborate to prevent NCDs. Similarly, there has to be a strong commitment from the patient, healthcare personnel, and policymakers. For example, my health is my problem. Why should I think that my health is the state's duty? As an individual, my health should be my responsibility. And unless that is driven home, people will not start thinking about their health. That should be all. Thank you so much.